10 Weird Signs of Stomach Cancer. Symptoms of gastric cancer. Did you know that stomach cancer can be silent and difficult to identify in the early stages? What really causes this dangerous disease? Is it possible to reverse early signs before the problem worsens? And what happens in your body when you ignore these subtle symptoms? These are just some of the questions that many people ask when it comes to stomach cancer. Whether due to the difficulty in identifying the signs or the fear of investigating the symptoms, many end up delaying seeking medical help, which can compromise the chances of a cure. In the past, when food preservation depended on excessive salt, stomach cancer was one of the deadliest diseases in the world. Today, with the advancement of science and access to information about prevention, we have a unique opportunity to act before it is too late. In this text, you will discover the main signs and symptoms, the risk factors, and how to prevent this condition with simple changes in your daily life. Remember, this is not an opinion, but a compilation of what science teaches us about how to protect your health. Get ready to understand how small choices can save lives. Let's get started. Do you always feel full, even without eating much? Find out what this could mean. One of the most common and easily overlooked early signs of stomach cancer is the constant feeling of being full, even after consuming small amounts of food. This symptom, known as premature fullness, occurs because the stomach may lose its normal ability to expand and contract. This may be caused by a tumor that changes the function or shape of the organ, making it difficult to digest and store food. Unlike common situations such as indigestion or the feeling of a full stomach after a very large meal, early fullness in stomach cancer is persistent. It can appear without an obvious cause and become frequent even with light meals or even when the person is fasting. This sign is often mistaken for temporary problems such as medication side effects, gastritis, or even anxiety. But when this feeling persists for weeks or months, it's a warning that something more serious may be happening. Another important factor is that early fullness is often accompanied by other symptoms, such as abdominal discomfort, nausea, and loss of appetite. These conditions can lead to a significant drop in food intake, which directly affects a person's weight and overall health. If you notice that you are experiencing this sensation regularly, it is essential to see a doctor. The upper digestive endoscopy exam is the most efficient method to investigate stomach problems and identify possible abnormalities, such as tumors or serious inflammation. The key here is to pay attention to how your body reacts to food. If something is out of the ordinary, don't ignore it. This symptom, when detected early, can be the starting point for successful diagnosis and treatment. Now that you know about this early sign, let's explore another, often ignored but equally important symptom. Ready to discover more? Dark feces and the warning that your body is trying to send you. One of the most intriguing and often overlooked signs of stomach cancer is the change in stool color. Darkened stools with a strong and different odor than usual can be a warning sign of something much more serious than a simple change in diet. This condition, known as melena, occurs when there is bleeding in the gastrointestinal tract. The blood, when digested by the stomach and intestine, darkens, giving the feces a color that varies from very dark brown to black. It is important to understand that this type of bleeding is not always continuous, which can make early detection difficult. Many people, upon noticing dark stools, end up opting for a fecal occult blood test. However, this test may not be sufficient, as bleeding from tumors is often intermittent. It occurs, stops, and reoccurs. Therefore, even if the result is negative, the possibility of a more serious problem should not be ruled out. The most recommended test to investigate this situation is upper digestive endoscopy. This procedure allows the doctor to directly view the inside of the stomach, identify possible injuries or bleeding, and, if necessary, collect samples for biopsy. Furthermore, it is essential to differentiate this symptom from other less serious problems, such as the use of iron supplements or the consumption of dark foods, such as beetroot or chocolate, which can also change the color of the stool. However, if the changes persist, accompanied by other symptoms such as abdominal pain, loss of appetite or fatigue, medical investigation should be immediate. Ignoring this sign can delay an important diagnosis, And because early-stage stomach cancer can have mild or almost no symptoms, noticing subtle changes in the body is crucial. Dark stools are your body's way of telling you something isn't right. Don't ignore this message. The next sign we'll explore is also closely linked to your overall health and is one of the most impactful: extreme tiredness. Ready to find out why fatigue can be a serious warning? Constant fatigue, lack of appetite, and even lack of breath when your body is asking for help. Feeling tired all the time, without energy for everyday tasks, is something that many people attribute to stress or a lack of rest. But what if this fatigue is a sign of something much more serious? In the case of stomach cancer, constant fatigue may be caused by anemia, a condition often associated with the disease. Anemia occurs when the body has difficulty producing enough red blood cells or when there is blood loss. In stomach cancer, this can happen in two main ways: small bleeds in the stomach, which often go unnoticed, or inflammation caused by the tumor, which makes it difficult to absorb nutrients necessary for the production of hemoglobin. When anemia sets in, the blood loses its ability to transport oxygen properly. This leads to symptoms such as paleness, extreme tiredness, and shortness of breath, even after minor physical exertion. Some people may also experience frequent dizziness or headaches, further worsening the impact on quality of life. Another worrying factor is loss of appetite. In stomach cancer, reduced appetite is often linked to feelings of early fullness or discomfort caused by the tumor. This creates a dangerous cycle. You eat less, lose essential nutrients, and anemia worsens, increasing feelings of tiredness and weakness. The good news is that anemia can be detected by blood tests, such as a complete blood count. This test evaluates the number of red blood cells and other important indicators, such as hemoglobin and hematocrit. However, identifying the cause of anemia is the most important step, and this often requires more specific tests, such as endoscopy. If you are constantly tired with no apparent explanation and notice other signs such as loss of appetite or paleness, see a doctor. Don't ignore your body language. Identifying and treating anemia can be the first step toward discovering and addressing a more serious underlying condition, such as stomach cancer. Now that we understand how fatigue can be a critical symptom, let's explore a sign that often starts as a simple annoyance, but can hide something serious: persistent heartburn. Ready to find out when heartburn can be a dangerous symptom? Heartburn and burning can be more dangerous than you imagine. Who has never felt that burning sensation in their chest or throat after a heavy meal? Heartburn is a very common symptom and is most often associated with benign conditions such as gastroesophageal reflux. But when it is persistent, intense, and accompanied by other signs, it can be a warning of something much more serious: stomach cancer. Burning occurs when stomach acid backs up into the esophagus, causing irritation. However, when cancer is present, the tumor can alter the natural acid balance in the stomach, worsening symptoms of heartburn and indigestion. This discomfort can be constant, even without consuming foods that would normally cause reflux, such as fried foods or carbonated drinks. One of the biggest problems associated with persistent heartburn is the indiscriminate use of medications, such as omeprazole and pantoprazole. These medications, known as proton pump inhibitors, are excellent for relieving momentary symptoms, but they can also mask serious conditions. By reducing stomach acidity, they may temporarily relieve pain and discomfort, but they do not treat the underlying cause. For example, a small early-stage tumor can cause burning and heartburn. By taking medications to solve the problem, a person may delay a vital diagnosis, allowing the disease to progress. Therefore, it is crucial not to use these medications without medical advice, and more importantly, not to ignore symptoms that persist for weeks. In addition to heartburn, other symptoms may appear, such as a feeling of heaviness or discomfort after meals and loss of appetite. These signs, combined, can indicate that something is wrong. If the burning or heartburn persists, the recommended test is upper digestive endoscopy. This procedure allows you to visualize the inside of the stomach and esophagus, identifying changes such as inflammation, ulcers, or tumors. Remember, experiencing heartburn occasionally may be normal, But when the discomfort is persistent or accompanied by other symptoms, it's time to investigate. Now let's address another sign that may seem common but is a late and dangerous warning: swollen lymph nodes. Ready to understand why these little lumps could be a sign of something more serious? Swollen lymph nodes, the small signs that can hide a big problem. Lymph nodes are small organs of the lymphatic system that act as filters, fighting infections and inflammation. When they swell, they are usually reacting to something simple, like the flu or strep throat. But when swelling occurs without any apparent infection, it can be a warning sign of more serious conditions, including stomach cancer. In the case of stomach cancer, the lymph nodes close to the organ may enlarge due to the presence of spreading tumor cells. This process is called lymphatic metastasis. Even more worrying is when lymph nodes in distant regions, such as the collarbone or armpits, begin to swell. This is a sign that the disease may be at an advanced stage. Swelling of these lymph nodes is usually not accompanied by pain, which makes the sign even more subtle and easy to ignore. Many people take these lumps for granted because they believe they will disappear over time. However, enlarged and persistent lymph nodes need to be investigated by a doctor. Additionally, it is important to differentiate swelling caused by a common infection from that related to more serious conditions. For example, enlarged lymph nodes during the flu are often tender to touch and disappear within a few days. Lymph nodes associated with cancer tend to be hard, fixed, and painless, and can remain enlarged for weeks or months. Clinical examination is the first step in investigating swollen lymph nodes. If the doctor identifies something suspicious, additional tests, such as an ultrasound or biopsy, may be ordered to determine the cause. In the specific case of stomach cancer, an upper endoscopy may also be necessary to assess the origin of the problem. Paying attention to these small signs can make all the difference in early diagnosis. If you notice enlarged lymph nodes for no apparent reason, see a doctor immediately. The sooner the condition is identified, the greater the chances of treatment and cure. Now, let's explore a sign that directly affects your quality of life: unexplained weight loss. Ready to understand why losing weight for no reason can be a worrying symptom? Are you losing weight for no reason? Here's what could be happening. Losing weight effortlessly may seem at first glance to be a positive thing. However, when it happens quickly and without explanation, it can be a warning sign of serious health problems, including stomach cancer. Unexplained weight loss occurs due to a combination of factors associated with cancer. Firstly, there is loss of appetite, a common symptom that is often caused by abdominal discomfort or the feeling of being full after consuming small portions of food. Another factor is the increased metabolism in the body, which, when trying to fight the tumor, can expend more energy than normal. Additionally, symptoms such as nausea, vomiting, or constant minor bleeding can contribute to weight loss. What is considered worrisome weight loss? Doctors generally recommend attention when there is a 10% reduction in body weight over a 6-month period without changes in diet or exercise habits. For example, a person weighing 70 kilos who loses 7 kilos during this period for no apparent reason should seek medical advice. The problem worsens when weight loss is ignored, especially if it is accompanied by other signs such as tiredness, dark stools, or abdominal pain. People often attribute weight loss to stress, changes in routine, or even temporary infections, which delays a proper diagnosis. To investigate unexplained weight loss, your doctor may order blood tests such as blood counts and inflammatory markers, as well as imaging tests such as computed tomography. In the case of stomach cancer, upper digestive endoscopy is the most recommended test to confirm or rule out the presence of a tumor. Don't underestimate the importance of monitoring your weight regularly. Losing weight unexpectedly can be a sign that something is not right with your health. Now let's explore another symptom that is often ignored but can indicate serious problems: stomach pain and abdominal bloating. Ready to understand why this discomfort could be a critical sign? Stomach pain and swelling. What could be behind this persistent discomfort? Feeling pain in the stomach or occasional abdominal bloating is something that many people experience, whether due to a heavy meal, gas, or even stress. However, When these symptoms persist or become frequent, they can be a warning sign of serious conditions, such as stomach cancer. Cancer-related stomach pain is often described as discomfort in the upper area of the abdomen, known as the pit of the stomach. It can range from a feeling of heaviness to more intense and persistent pain. Abdominal swelling often accompanies this pain, creating a feeling of general discomfort. These symptoms may occur because the tumor alters the functioning of the stomach, making digestion and gastric emptying difficult. In some cases, swelling is caused by the accumulation of gas or fluid in the abdominal cavity, which may indicate that the disease is at a more advanced stage. A common mistake is to resort to medications such as omeprazole or antacids to alleviate these symptoms without seeking medical advice. While these medications may offer temporary relief, they may mask a more serious problem, delaying an important diagnosis. Another point that deserves attention is that pain may be accompanied by other symptoms, such as loss of appetite, nausea, or changes in bowel habits. When these signs combine, the chance of it being something more serious increases significantly. To investigate the origin of pain and swelling, an upper endoscopy examination is essential. It allows the doctor to view the stomach in detail and identify possible tumors, ulcers, or other abnormalities. In more advanced cases, imaging tests such as CT or MRI may be necessary. If you regularly experience stomach pain or notice that bloating doesn't go away, don't ignore it. The sooner the condition is evaluated, the greater the chances of identifying and treating any underlying problems. Now that you know more about this sign, let's explore the non-modifiable risk factors that can increase your chances of developing stomach cancer. Ready to understand how genetics and other factors can influence your health? Stomach cancer. Risk factors you cannot change, but need to understand. Some risk factors for stomach cancer are beyond our control, but knowing them can help identify the need for preventive care. These factors include genetic characteristics, family history, and even blood type. One of the biggest non-modifiable risk factors is age. Stomach cancer is more common in people over 65 years of age, which may be related to the natural wear and tear of the body and the accumulation of environmental and dietary factors throughout life. Another important element is family history. Having first-degree relatives, such as parents or siblings, who have had stomach cancer significantly increases the chances of developing the disease. This may be due to specific genetic mutations, such as those linked to the CDH1 gene, or to eating habits and health conditions shared in the family. Blood type also plays a curious role. Studies show that people with blood types A and AB have a higher risk of developing stomach cancer compared to those with type O. The reason for this association is not yet completely understood, but it is believed that it may be linked to immunological characteristics. The importance of knowing your family history is crucial. If someone in your family has been diagnosed with stomach cancer, the medical recommendation is to start preventive exams such as upper digestive endoscopy about 10 years before the age at which the relative was diagnosed. For example, if your father had cancer at age 50, you should start screening at age 40. While we cannot change these factors, we can take action to reduce overall risks. Maintaining a balanced diet, avoiding harmful habits, and having regular exams are measures that can make all the difference. Now that we've addressed the uncontrollable factors, let's shift focus to what you can do to significantly reduce your chances of developing stomach cancer. Ready to discover practical steps that can transform your health? 5 practical steps to reduce your risk of stomach cancer. The truth about cigarettes and alcohol, how they silently increase risks. Smoking is widely recognized as one of the biggest health hazards, but few know that it also significantly increases the risk of stomach cancer. The chemical substances present in tobacco can cause inflammation and damage to the stomach lining, creating favorable conditions for the development of tumors. Alcohol, especially when consumed in excess, is also a major aggravating factor. It irritates the stomach lining, increasing inflammation and enhancing the effects of other risk factors, such as the consumption of processed foods. The ideal is to completely eliminate cigarettes and moderate alcohol consumption. If this seems challenging, Seeking medical help or support groups can go a long way toward protecting your health and significantly reducing your risk of cancer. Salty and processed foods. What you should avoid now to protect your health. Excessive consumption of salty and processed foods is one of the main factors contributing to stomach cancer. Products such as instant noodles, snacks, processed meats, ham, salami, mortadella, and ready-to-eat meals contain high levels of sodium and preservatives such as nitrates and nitrites. These compounds not only irritate the stomach, but can also turn into carcinogens when exposed to the stomach's acidic environment. Studies show that consuming processed meats 3 times a week is enough to significantly increase the risk of cancer. Replacing these foods with fresh, natural options is essential. Choosing fruits, vegetables, and lean proteins not only reduces the risk of cancer, but also promotes the body's overall health. Move. The impact of an active lifestyle on your risk of cancer. A sedentary lifestyle and being overweight are directly linked to an increased risk of several types of cancer, including stomach cancer. This occurs because adipose tissue is metabolically active and can release inflammatory substances that favor the growth of tumors. Incorporating physical activity into your routine is one of the most effective ways to reduce this risk. It is not necessary to start with intense exercise. Regular walking, stretching, or recreational activities such as dancing can already bring significant benefits. In addition to helping with weight control, physical activity improves digestion, regulates hormonal levels, and strengthens the immune system. Dedicating at least 30 minutes a day to physical activity can transform your health. H. pylori, the dangerous bacteria that half the population carries without knowing. The bacterium Helicobacter pylori, or H. pylori, is one of the main risk factors for stomach cancer, and around 50% of the world's population is infected with it. This bacteria is transmitted through contaminated water or food, and can cause chronic gastritis, ulcers, and eventually cancer. Fortunately, this condition is treatable. Diagnosis is made by tests such as respiratory testing, endoscopy, or blood tests. If the presence of the bacteria is confirmed, antibiotic treatment can eradicate it, significantly reducing the risk of future complications. Ensuring adequate hygiene when handling food and drinking water from safe sources are simple but effective steps to prevent infection. Polyps in the stomach, what you need to know and how to act. Polyps are small growths on the inner wall of the stomach, and although not all are dangerous, some can develop into cancer. They are usually discovered during an endoscopy, often performed for other reasons such as abdominal discomfort. If polyps are detected, your doctor may recommend removal, especially if they are of the adenomatous type, which is more likely to become malignant. After removal, it is essential to follow up regularly to ensure there is no recurrence. Having periodic exams, such as endoscopy, is the best way to monitor your health and avoid future complications related to polyps. Now that you know practical steps to reduce your risk, let's explore the powerful role of diet in preventing stomach cancer. Ready to discover how your diet can be an ally in protecting your stomach? The power of food in preventing cancer. Diet is one of the most important pillars in preventing stomach cancer. A balanced diet rich in natural foods not only reduces the risk of disease, but also strengthens the immune system, improving the body's overall health. Fruits, vegetables, and fiber-rich foods play an essential role. Studies show that consuming fruits rich in vitamin C, such as oranges, lemons, strawberries, and kiwis, can help neutralize the harmful effects of chemical preservatives, such as nitrates and nitrites, present in processed foods. Vitamin C also acts as an antioxidant, protecting cells against damage that can lead to cancer. Cruciferous vegetables such as broccoli, cauliflower, and cabbage are particularly effective. They contain compounds called glucosinolates, which help fight carcinogens and reduce inflammation in the digestive tract. Furthermore, adequate fiber consumption promotes healthy intestinal transit, facilitating the elimination of toxins and harmful substances. Foods such as whole grains, seeds, and legumes, beans, lentils, and chickpeas are excellent sources of fiber and should be incorporated into the diet daily. On the other hand, it is important to avoid foods that increase the risk of stomach cancer. Processed meats, foods rich in sodium, fried foods and ultra-processed foods should be consumed in moderation or completely eliminated. Another valuable tip is to avoid excessive consumption of alcoholic beverages and prioritize healthy preparation methods such as boiling, grilling and roasting rather than frying. Small changes to your diet can bring big benefits. Plan your meals in advance, choose fresh foods and try new combinations to make your eating routine healthier and tastier. Now that you've learned how food can be your ally, let's close with a motivating message that reinforces the importance of taking action today to protect your health. Ready to take the first step towards a healthier, longer life? Don't ignore the signs. Your choices today can guarantee a healthier future. Health is the most precious asset we have, and taking care of it is a responsibility that we cannot postpone. Now you know that stomach cancer, when identified early, has a high chance of being cured. However, this is only possible if we pay attention to the signals our body gives us and act proactively. Every choice we make today, whether in food, lifestyle, or seeking preventive exams, directly influences our future. Adopting healthy habits, abandoning harmful behaviors, and investing in a balanced diet are simple steps that can save lives. Remember, detecting something early is not a reason for fear, but for hope. It's the opportunity to change the course of history and ensure more moments with the people we love. So the question remains, what can you do today to take care of your body and protect your health? The first step starts now. You are not alone on this journey. Science is on your side, and the information you learn here are powerful tools to transform your life. Choose health. Choose prevention. Choose to live fully. Are you ready to start this transformation? The time is now. Take care.